Hello, it's Dr. Christine Arseneau, PharmD, Functional Medicine Certified Health Coach. And today I'm going to discuss sleep and what you can do to improve your chances of having a good night's sleep, improving your quality of sleep. I know a lot of you are struggling with this. Insomnia is an issue that happens a lot of the times with people who are going through Lyme disease and other tick-borne infections. And sleep affects everything in your life. So if you can do anything to improve this area, it's going to have a ripple effect on your health. So sleep is very important for our bodies to rejuvenate and rest and renew cells, and the lymphatic system in your brain works at night. That's when you go through and get rid of any toxins. Your whole body detoxifies at night while you sleep. Sleep has so many benefits, and you just feel better when you get better rest. If you're not sleeping well, it affects your whole day. It affects how you feel the next day. And if it's a chronic problem and you're having insomnia night after night, it adds up and it really has a negative impact on your health. So today I wanted to focus on what we can do to really hone in on our routine for bedtime to increase our chances of improving our sleep, of getting that good night's sleep that we're really after. And it's not so much about, supplements, medications, those kind of things. They might have their place, and there's going to be times where you might need them, but ultimately a lot of those medications aren't giving you really the quality of sleep that you want. That occurs naturally. They can disrupt certain cycles in your sleep. So I'm going to focus just on the lifestyle factors more so than any supplements. I know when I was going through Lyme disease, I was taking like 50 supplements a day, and it was really hard for me to tell what was working and what wasn't, and what was helping with symptoms and what wasn't, because I was doing so many things. And so I don't think the answer is always just throwing more supplements and medications on top of your regimen. It can get frustrating and overwhelming and defeating to be taking so many things and to not even know why you're taking some things, if they're working, what's having the biggest impact for you. So if we can just really hone in on your lifestyle and how you're living your life day to day, then we don't have to add other supplements. And if you can get some habits in place, lifestyle changes might be enough that you can get rid of certain supplements, certain medications. So that's the way that I prefer to work. I don't like to just focus on putting pills in somebody's body. So the main thing with sleep, with our quality of sleep and how we're going to accomplish this, is light. So if you think about light, our ancestors, we didn't used to have electricity. We would get up when it got light outside, we'd go to bed when it got dark outside. And the light signals to your body when it's time to sleep and when it's time to get up. And that light signaling our brain is really important to get us winding down and knowing when it's time to go to bed. So it's important to have sunlight exposure during the day so that you're signaling to your brain, it's daytime, it's time for me to be awake. And if it knows that it's time for you to be awake, then it knows when it's time for you to sleep. The problem is, in our society now, we have electricity, we have electronics. The blue light that is emitted from your TV, your phone, your computer, everything that you're using, that signals to the brain that it's daylight, that it's time to be awake, to be active. So if you're on your electronics at night, that's telling the brain to be active, and it's going to be hard to then wind down and go to bed. So I don't recommend being on electronics at night. Really, you probably shouldn't use light at all, any light, electricity or anything. That's, might be hard for people to do in modern society. So I recommend blue blocking lights. You buy lights, sunglasses, and blue blocking sunglasses. Yeah. So you buy sunglasses, they block out the blue light. So you're not stimulating the brain that it's time to be awake. And so you can wear those when you're on your electronics, especially in the evening before bed, and that might help you be able to transition easier into sleeping. So sunlight is a big thing, and just going outside in the sunlight during the day that can just really help regulate your sleep cycles. And Dr. Jack Kruse has some great podcasts and interviews when it comes to sunlight and the mitochondria and how important light is for your health. And he says light is like 2/3 of the equation. It's more important than food, more important than anything. Your mitochondria are what makes energy. They're the powerhouses of energy in your body. So your mitochondria, really, really important, and they need sunlight. Just getting out in nature as much as you can, being exposed to natural light during the day as much as you can, that's going to have a huge impact on your sleep. So if that would be the biggest thing that you could do is be exposed to sunlight during the day. Don't expose yourself to blue light at night. Just right there, that could have a huge, huge impact depending on how you're living your life now. The more time you can be outside, the better. And while you're outside, earthing, grounding is a good idea. Getting those electrons, so it's all electrons. You pick up electrons from the earth. When you're barefoot, they get absorbed. If you're walking by the ocean, that's even better. When there's water there, they'll be absorbed even more. Picking up those negative electrons from your environment decreases inflammation, decreases pain, helps with quality of sleep. I've heard people tell me all the time when they start earthing, when they start grounding, when they get out there barefoot, that their sleep quality improves. So decreases inflammation, decreases pain, and improves your sleep. So get outside as much as you can, barefoot if you can, or whatever you can do for grounding, whether that's picking up rocks, touching trees, even just houseplants inside with your hands in the soil. Any kind of grounding is going to be helpful for your sleep regimen as well. And then we want to talk about the environment of your bedroom, your sleep environment. And so you want to create a safe haven for sleep, something that is conducive to having a good night's sleep. You want to really have a sleep sanctuary. You want your space to be a sacred space that's meant just for sleeping. So you don't even want a TV in the bedroom. You want this to be your time for rest. And we want a cool temperature that's going to make sleeping easier. You want a dark environment. So you don't want electronics in the bedroom. You don't want light coming in from lamps, street lights outside, whatever it is. So you might want to get some blackout curtains, do whatever you can to have a fully dark environment that will help your sleep. You might want to incorporate some aromatherapy. Things like lavender are good for relaxation. So adding something like that in the bedroom might be something, if you make that part of your bedtime routine, you're going to trigger to your brain that it's time to get ready for bed. So the more that you're in that routine, that consistency, the more you're triggering your body to wind down to get ready for that bedtime routine. And then you want to look at any toxins in the environment, which that's a given with Lyme disease in general. We always want to be aware of toxins in our environment and get rid of what we can because we're already detoxifying. We already have a heavy pathogenic load, a heavy toxic load. We're constantly detoxing, so we don't want to take on any new toxins. So when it comes to sleep, you want to look at your mattress. Is it off-gassing? Are there anything that could be made healthier in the bed itself, the quality of products that you're using, make sure there's no mold in the bedroom, things like that. So just making sure that it's a safe, comfortable environment. Maybe you get an air filter or something like that. And then also, no stimulation. So this is another reason, no electronics, but especially like if you're watching the news, if you're watching something that is going to stimulate you and get you excited or upset, that's going to be bad for your bedtime routine, for getting into that winding down pattern of getting ready for sleep. And so any kind of stimulant, so caffeine, things like that as well, you want to make sure that you avoid those as it gets later on in the day, closer to bedtime. And just the consistency of that bedtime routine. You're going to tell your brain that it's time to start winding down. It's time to get ready for bed. And so if you have a consistent wind down routine, maybe you start at 7 or 8 or 9, whatever works for you, just so that you're getting into the habit of telling your body that it's time for relaxation. That's going to really be helpful. One of the biggest things for quality of sleep is the consistency with the time that you go to bed. So even if you get more hours, but you're changing the time that you go to bed, it's not going to be as good quality sleep as if you go to bed at the same time every night. So this is whether it's a weekday or a weekend, no matter what. If you can try to go to bed about the same time every day, that's going to have huge benefits for your sleep routine. And then just keep in mind that the sleep before midnight is better quality than the sleep after midnight. So if you can get those hours in before midnight, that's going to be advantageous as well. So have consistency in your routine, especially have consistency with the time that you go to bed and the time that you get up as well. And then your routine should consist of things that are going to help you relax, whatever that is for you. So that could be like maybe some journaling, maybe some artwork, maybe breath work, maybe some stretching, maybe certain essential oils. And this, maybe you do have some supplements that you like melatonin or magnesium or different essential oils or, kava or whatever it is for you. That might be a good time to incorporate some things in. Meditation, aromatherapy again would be good too. Affirmations, visualizations, just make a routine. I'm a big fan of morning routines as well, but bedtime routines. So think about the things that you really want in your life, that you really want to create, what habits you really want, and fit those into your morning and bedtime routines and make this something that you're really striving for that's going to help you become a better person. Maybe it's a gratitude journal, having gratitude for those things in your life that you're grateful for friends and family, different blessings that you have. So think about something that, would add some meaning to you. It's not just about getting to sleep, but it's about your overall life and your goals and how you show up. And so pick some things for your routine that are just going to really help you become the person that you're becoming, the person that you want to become, that healthy version of yourself, not the person with Lyme disease, but that healthy, vibrant version. Who is that person? And what kind of habits do they have to stay in that optimal wellness? And start adding those, start implementing a plan. Another thing is eating. So you want to stop eating at least 3 to 4 hours before bed. So that way your body has already digested. And when you get to sleep, your body can just go straight away, work on detoxing and resting and renewing instead of having to digest. So that can help with the whole detox process if you allow enough time between your last meal and the time that you get to bed. And we all have different issues. A lot of us have been chronically sick, and not all of these rules are going to apply to everybody. Some people might have issues with blood sugar going too low in the middle of the night. They might have to have a snack before they go to bed. So I'm always a proponent of individualized medicine and looking at a person, all the details that make up you and what's going to work for you. What works for me is not going to be exactly what works for you. So it's always finding a routine, finding a plan that's going to fit into your life and that's going to enrich your life and that is going to have the benefits that we're looking for, that increased quality of sleep. And then the biggest other thing is that natural light that I mentioned, seeing it first thing in the morning. Ideally, you'd want to see sunlight within 10 minutes of waking up. Within 30 minutes is okay too. But if you can get out of bed and be exposed to natural sunlight right away, that's triggering the brain, again, that this is morning, this is time to wake up, so it knows when to go to bed. And that light, especially from the sunrise, it's, different level of light than in the middle of the day. So if you're able to watch the sunrise every day and see that light and trigger to the brain that it's time to wake up, that's going to have such a beneficial effect on your sleep quality. So get out there, see the sunrise whenever you can, or just get outside first thing if you can. If you can get outside barefoot and ground and see the light, that's going to be even more powerful. So those are just some tips on sleep and specifically how nature kind of ties into sleep and how you can, go outside, get some sunlight, touch the ground, get into a routine that's really going to benefit you. It's really going to serve you and help you reach your goals. And if you do these things, if you can really hone in on your routine, you don't have to worry about the supplements and medications as much. And you still might need those things, especially if you have, chronic illnesses and you have so many things that you're treating. Sometimes we do need medications to get us to that place where we can at least get some sleep so we can start to heal, to get us out of cycles that are, really bad if we're all over the place, and it's wreaking havoc on our body. So everything has a time and place, but if you're able to put this routine into practice and be really consistent with it, you will see your sleep quality change. So I'm excited for you. Let me know how it goes, and I hope you have a wonderful day.